This is V, a quadriplegic patient. She couldn't move any parts of her body from the neck down and has spent most of her life in hospital bed. There are thousands more like V who are suffering the same medical condition throughout the world.
But no worries, V. We have spent days and nights designing a bed that can help you make feel better. With our new invention, patients like V can now control the basic functions of the bed all by themselves.
These functions will help improve the patient's way of life. For instance, a patient can actively change the legs or head portions of the bed to a more comfortable position. Moreover, the bed has a built-in massage function that will reduce the patient's bed sores, muscle aches, and improve blood circulation. There's also an emergency function which will quickly call for help or assistance should the patient need to. Most importantly, the patient does these functions just by thinking in their head, all thanks to EEG technology. We have a list of functions that we want for our design, and the decision matrix helps us choose the final set by putting the patient's safety and the bed's efficiency on top of everything else. Speaking which, imagined movement associated with the set of functions that we have is also really important. That's why our group spent a lot of time researching on this topic. To come up with our final choice, we create a decision matrix weighing the strength, the sensitivity to noise, and the uniqueness of the generated signals in order to select the most reliable ones, which are the movements of the feet, hands, tongue, and eyelids. By imagining moving his left or right hand, a patient can move the bed's head up or down respectively. These actions generate brain signal recorded from bipolar C3, CZ, and C4, CZ electrodes. There is a change in brain rhythm from alpha to beta and a stronger C3 CZ channel for left hand and a C4 CZ channel for right hand. To avoid patients from falling over, we limit the head of the bed with a maximum angle of 30 degrees. Ultimately, by imagining moving both hands together, the patient will trigger the emergency command, which will immediately call for help. These actions generate strong signals in all C3, CZ, and C4 positions, making them easier to detect, which is suitable for emergency function. Similarly, imagined movements of the feet can be used to move the bottom part of the bed up or down. It is true that they produce almost identical signals because of the motor cortex control left and right foot are close together. However, we are able to discriminate between left foot and right foot movement up to 81% accuracy by using bipolar method to detect the difference in beta rebound. We capture signals from two pairs of electrodes, C1, CZ, and C2, CZ. The signal of the right foot movement will generate larger beta rebound at C1, CZ channel, while the left foot signal is larger at C2, CZ. The massage function is turned on by a command associated with imaginary tongue movement. There will be an increase in power with frequency around 12 Hz detected by CP2CZ electrode. Same action will stop the massage if it's already on. To cancel a command, the patient can simply blink their eyes a few times. The signal generated by this action will be recorded by FP1, F3, and FP2, F4 channels, which are associated with frontal and prefrontal lobe of the brain. Normally, eye blink causes artifact in EEG signal. However, by repeating the action, eye blink can make a pattern to produce a stop command. After deciding on our desired functions and brain signals, we move on to design our device. We start by making an overall schematic of the bed, followed by a set of flowcharts to outline how we record and decode brain signals into mechanical actions of the bed. For data acquisition, we use electrodes of 8 mm of silver and silver chloride on this set of positions from the 1020 International model. And for amplification, we use the 8-channel model ProComp Infinity. We then identify the area of the brain from which EEG signal is generated by looking at the positions of electrodes that record such a signal. Based on this information, we pick the method by which we use to process the data. Because most of the EEG signal that we acquire is from alpha and beta band, we apply bandpass filter to denoise and remove artifact. For feature extraction, we use two sets of characteristics, which are autoaggressive adaptive parameters and spectral energy in alpha and beta bands. For classification, we use two methods, linear discriminating analysis and neural network. Finally, we generate and send commands to the bed's hardware to perform mechanical actions.
It is true that our design cannot fully restore a quadriplegic patient's mobility, but it does improve their life tremendously by helping them perform the basic tasks independently. Considering the rapid growth of EEG technology and computer's capacity, we hope to incorporate more advanced functionalities to our design in the near future. Our goal is to utilize the endless possibilities of biomedical engineering to help patients like me be back on their feet.